Thousands of years ago, in addition to the human species we see today, which are Homo sapiens, there were other species of humans, one of which was the Neanderthals. Neanderthals had a prominent forehead compared to modern humans, especially in the lower part of the forehead. Well, some traits of Neanderthals still exist in modern humans, and sometimes we see individuals with a very pronounced prominence in the lower part of their forehead that reminds us of the faces of Neanderthals. If we pay attention to the faces of these individuals, they appear somewhat rough, angry, and sometimes scary for children compared to ordinary people. A person with such a face, if they practice martial arts or have a job where anger can solve their problems, might be satisfied with this appearance and not want to change it. However, for many individuals, being perceived as an angry or rough person does not create a good reaction, and they tend to want this unattractiveness to be corrected and to have a gentler face. For these individuals, whom we refer to as having a Neanderthal forehead or a prominent forehead, we can have solutions to correct the unattractiveness. To correct a prominent or Neanderthal-like forehead, we can use surgical or non-surgical methods. In non-surgical methods, we cannot correct the prominence itself, but we can use fat injection to enhance the tissues that are further back, meaning the upper part of the forehead. By injecting fillers, we can transfer them to the front areas to make the forehead appear smoother. In addition to the unattractiveness that may be seen in the forehead area, many individuals with a prominent or Neanderthal forehead have relatively sunken eyes. If we use non-surgical methods, their sunken eyes will not improve at all. Therefore, in most individuals, meaning over 95% of people, we prefer not to move the forehead forward and enhance it at the upper part, but rather to push the prominence of the lower forehead further back so that the forehead becomes smooth and uniform and the eyes come out of the sunken state. The reason why some individuals have a prominent forehead that protrudes so much can be attributed to various factors. We see that the prominent or Neanderthal forehead in men has a significantly higher starting point compared to women. Sex hormones can play a significant role in the growth of these bones. Alongside that, we see individuals who, for various reasons, have excessive growth hormone in their bodies, causing all bones to grow, especially the extremities, which can create a face resembling that of Neanderthals. In such cases, we must first control the underlying cause, meaning we need to stabilize the hormonal changes before we can address the unattractiveness. The frontal sinus is located in the lower part of the forehead, and this prominence is actually part of the sinus wall that has grown and protruded forward. Therefore, when correcting this prominence, it is essential to ensure the health of the frontal sinus. In some cases, this excessive growth of the sinus wall may be due to sinusitis or tumor-related causes. Through pre-surgical evaluations, including a CT scan taken before surgery, we examine the skeletal structure of the face and the sinuses, and based on that, we develop a treatment plan. If during the pre-surgical evaluations, we find that there is a specific and identifiable disease in the frontal sinus, it is necessary for us to thoroughly address that disease. Often, sinusitis is accompanied by obstruction or narrowing of the sinus passage. There is a specific disease that needs to be addressed. Often sinusitis is accompanied by obstruction or narrowing of the sinus passage, which we can resolve during surgery to restore the sinus to its normal and healthy state. If you pay attention to this image, you will see that there is opacity in one of our sinuses, and secretions have accumulated inside the sinus, while on the opposite side, the sinus is completely clear, and there is no disease present in that area. It is important to know that if there is a sinus disease, in order to avoid unpleasant symptoms, during this procedure, the sinus disease must be controlled and the infection resolved. Therefore, I recommend that if you want to undergo forehead contouring surgery, you should definitely ask your surgeon to address any sinus disease in the frontal sinuses as well, so you can achieve better results. By resolving sinus infections and sinusitis, not only will the symptoms be alleviated, but the surgical outcome will also be optimal, and the likelihood of recurrence after resolving sinus issues is significantly reduced. If we were not aiming for aesthetic changes in the face, we could completely treat the sinus disease using endoscopic methods without external incisions. However, in cases where we want to aesthetically correct the forehead contour, it is necessary to make an incision at the top of the forehead, either within the hair or in front of the hair, so that we can access the bone and change its shape. Typically, this surgery lasts between 2 to 3 hours and can be performed under general anesthesia after the individual regains consciousness and is fully alert. They can be discharged and return home. The question that arises here is, what age is appropriate for this surgery? We know that a prominent or Neanderthal forehead does not develop in childhood. With age and after puberty, the bones grow and create such a shape. In children, the frontal sinus is either not formed at all or has not yet developed. So a prominent forehead is rarely seen. After puberty, if sinus growth continues, it can lead to prominence of the frontal sinus. If we decide to proceed with surgery, we must ensure that the growth of the sinuses is complete, and we prefer to postpone this surgery until after the age of 20. The question arises whether there is a possibility of bone growth after surgery, and if this condition might revert to its previous state. The answer is that we must control the factors affecting bone growth by any means necessary. Sometimes bone growth occurs due to hormonal changes, meaning if someone has excessive growth hormones secreted in their body, we need to address that factor. Sometimes the growth of the sinus wall occurs due to sinus diseases, which we address simultaneously with this cosmetic surgery.